you're working crazy hours, you're working nights, you're working shifts that like people outside of the medical profession would never be allowed to work. And there's a lot of questions there, right? Is not doing overnight shifts, is that a reasonable accommodation? What's reasonable or not, right? Because one would argue that the vast majority of things that we do to ourselves in medicine are really just not reasonable working conditions at baseline. So you really have to look at that. Is it reasonable to have women in their third trimester working 24-hour shifts? Is it reasonable to chronically sleep deprive someone who has a history of mental health condition, knowing that sleep deprivation could destabilize them? You can replace that with seizure disorder or migraine. So there's always a question that comes up of what's reasonable and how it will impact clinical service.